Heart to Heart on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. You still have some time to make a telephone call. The phone lines are open until 8 o'clock. The number to call is 717-346-3333. And here is our last viewer question. My primary physician suggested I see a doctor from the Med Center because I failed a stress test this week. I live near Hanover and I'm in my 60s. I don't like to drive far. Can you suggest a doctor close by?
Certainly. We at Penn State Hershey Medical Center and the Heart and Vascular Institute have collaborative efforts, working relationships with physicians both at Hanover Hospital and at Holy Spirit Hospital. So I would encourage this patient to go to the hospital near them. Certainly if there's any questions, the doctors talk to us in consultation, but that may be the easiest and best way to treat their health.
Okay, Dr. Ettinger, thank you so much for answering our questions this evening. And we want to thank all of the specialists. Once again, the phone lines are open until 8 this evening. Chuck, we'll send it back to you.
Thank you, Deborah. And joining us on the set right now is cardiologist Dr. Ever Liska. Now, I wanted to talk about earlier, we referenced rhythm disorder and a heart attack. So what is cardiac arrest?
Well, cardiac arrest happens to about 300,000 Americans each year. And it basically is when your heart stops.
300,000?
Yep.
That's an impressive number. Now, here's a very basic question. We always hear in movies everything seems to go real well when somebody collapses. There's always somebody who seems to know, what should I do as a layperson? If I see I'm at a party and somebody collapses, what do I do?
Well, the speed is of the essence in that case, and you really need to rush to the person's side and see if they're responsive. If they're not responsive, you want to call 911 and look around for an AED. And then you want to start CPR quickly. If you're not trained in CPR, you can start compression-only CPR, where you're just doing compressions.
Is that what you call hands only?
Yes, that's the same thing.
That's a big change, is it not, from what I learned in the Scouts and in boot camp and so on. Is it effective?
It is. It's for folks that are not trained in CPR, if they see someone collapse and they start compression-only CPR, the chances of that person living are just about, or sometimes better even than standard CPR, mouth-to-mouth included.
All right. Is there any danger someone who's not trained CPR at least trying something?
You know, there's no, generally speaking, trying to help someone in that circumstance is better than not doing anything at all. These people have very little chance of surviving without your help.
So get in there and give it a shot, and,
That's right.
and try to help them out there. Now you brought along, we can grab this AED device. We referenced this a couple of times earlier, and I'm not sure exactly which camera we want to play this to, but just hold it up, they'll find it. Let's talk about that. How is this explained? It's a fancy word, hard to pronounce. What's it do?
It's an automated external defibrillator, and you'll see a lot of these in the public these days, in public places, and it's very easy to use. So the key is when someone collapses, rushing to their side.
Let's hit that button there, if you would, Doctor. Show what that does.
Sure. Yeah, simply turn it on, and then you'll start to hear voice, which will describe what to do.
Apply pads to patient's bare chest.
So in that case,
Plug in pads connector next to flashing light.
you plug in the device, and it walks you through exactly what you need to do.
All right. I mean, I didn't know it was. I need that in my putting my reports together. Thank you, Doctor.
Sure.
And we also want to thank you, the viewers, for sharing your stories and sending in your questions. If you would like more information or you'd like to schedule an appointment with Penn State Hershey Heart and Vascular Institute, you want to call 877-467-7484, or you can visit online at pennstatehershey.org, Heart and Vascular. And like many of us, if you made a New Year's resolution to live a healthier life in 2013, you want to come out to Macy's at Harrisburg Mall this Saturday from 10 in the morning till 4 in the afternoon, and there you'll get a free health screening and more. And to check on that, you want to go to pennstatehershey.org. Again, Heart and Vascular for more details. As always, we thank you for watching, and we wish all of you good health.